An intervention that I helped develop, the Dad's Manor thing, I'm going to talk about now, and some of the strategies that we really found helpful. Some of them apply, some of them don't, but I think many of them can definitely fit in. So thank you for this. So keep this in mind. Please feel free to keep asking me questions as I go. And one other little quick piece here. So there's not a lot out there in terms of kind of best practices in healthcare settings. One or two articles really around and they're just recommendations or things to think about possibly. And this is one of the more recent ones. And the recommendations were, they called it reciprocal engagement, which is just to be willing to interact with both parents, to have a discussion, to send communications as sort of a best practice idea, to promote or encourage early father-child care. So this is thinking about right after the birth and thinking about both sort of not equal time necessarily, but giving both access and both kind of promoted sort of maybe not necessarily the skin-to-skin idea. I remember doing that because my son, my oldest, wouldn't latch on, and so she had him for so many hours, and he was still struggling, and so they passed him to me, and we sort of rotated back and forth on this. It was a days-long thing. This is why I don't remember anything from that. We didn't sleep for days because we couldn't get him to eat. He was very jaundiced, and it was just on and on and on. Discussing the parents' attitudes, beliefs on parenting. So this is the second bullet and the third a little bit, and that's asking dads, asking moms, why do you want to be a parent, or what about this is exciting for you? What about this is stressful for you? Becoming a new parent, that sort of, and we integrated those questions a lot, and then talking about, and this is probably much more of a challenge. They talked about healthy relationships and how do you promote healthy parenting relationships very early on. In healthcare settings. And I was curious too if you ever get to this point. Do you talk about co-parenting, parenting together strategies, even healthy relationships things? I think that was a little bit more of a reach I felt that I'm sure that you don't get to or don't have the opportunity to. We do a little bit more in sort of the home visiting area. But when we did research, we found that parenting relationship was an indicator of everything. That was across the board in our pilot and our current study, having an influence on parenting together, people's alliance with each other as a parent, people's negative feelings about the other parent, and some of the other outcomes on access for the other parent to be parenting and their support of each other. So there was lots of tie-ins with that as well. And then another was parent health. Actually thinking about mental health and other physical health, talking about that, having that conversation together. Okay, so what did we find? So really quick, my 2-second overview of my intervention. And so this is designed to be not replacing anything that was going on, but just to sort of be on the top and for people to think about as they were preparing for visits, or during a visit or after a visit. So thinking about the lead-in, the follow-up, and then everything in between was sort of a mystery. But we added some strategies in. And we started with thinking about assessment, and we tested it in all of these different, it was a large variety of programs and settings. It looked very different across all of these programs. We started with assessing the father's role in the family, and this gave us a really good opportunity to ask dads questions and moms questions about dads and starting a really fun conversation. And then this assessment led towards other assessments and thinking about what the actual services were. And we talked about assessments like doing assessments on the mom and the child. I don't know if you do screenings on the kids in terms of their development, but one of the things that ended up being a really effective, at least engagement strategy, was doing the ASQ. I don't know if you get to the ages and stages questionnaire at all. They're very young, obviously. But that was sort of a really fun thing that moms could do, dads could do, and then they could kind of fight over the score in a very fun way. And people, they all were doing this because they have little older kids. And they found that to be really, really fun. And it's sort of an assessment idea beyond the mental health screenings. That was a lot of fun. Then we did lots of different engagement strategies with dads. I have a screen on that coming up. Let's see. And then supporting, and then we developed these modules on how to support the co-parenting team together. So especially with teen parents and becoming parents for the first time and suddenly being vaulted into adulthood, thinking about your roles in that transition and thinking about the stress that comes with that. I don't know, with teen moms, teen dads, I always say, well, and this is with all parents, like the stress of the unsolicited parenting advice from everybody that surrounds you on the streets. And I don't know, I got this all the time. Oh, you shouldn't do that. Why are you letting your kid do that? They're running across that lawn. I'm like, ooh, they're running across a lawn. Like, how dare I let my kids run? I got this all the time. But all of this random stress that comes with it. And then providing support for very specific father-related issues around mental health, and some of these help-seeking things. And we did it, so we started with a pilot, then we rolled it out into a randomized study, and then we're in our next phase now. But each stage we'd go back to these groups and talk to fathers and mothers and caseworkers and home visitors to get everybody's kind of thoughts on how it went and what we could do better. And this was so important, especially when we started with the fathers, to get their thoughts on things, because they reframed the whole thing. Because if we would have just talked to mothers and workers, all we would have done is a group-based approach during the evenings, because that's the only recommendation that we really got kind of concrete out of it. And Dad said, you know, ask us to come, ask us to join. And then our next phase is we're going to have this online tool that we're going to launch here shortly. Okay, so most importantly, we found that we needed to know our population. That was interviewing the dads, talking to the dads directly, and following up with them to see how it was going. Engage everyone in the organization. So our pilot study initially failed because we didn't take into account everyone in the organization. And that was the person who was out that week when we did the training, who was the intake worker. And the intake worker was obviously the gatekeeper to everybody that came into the program and everybody that came into our intervention. And she didn't feel like fathers should be in the program. And so we got no referrals. So we had to restart. And this was month after month. We were just like, is there no one eligible? And she just didn't feel like fathers should be eligible for the program. So initial failure, and then it got better. Engagement, creative assessment strategies. I mentioned the mental health screening, but creativity, using people's skills to engage. You're all people. You can work with people, and you're all very good at it. Use those skills across the board. And I can't encourage that more, because every time we would go back and say, what did you do well? They would find some new clever way to tell us how they engaged dads using something that they were just particularly good at. One was assessment, so that's where the assessment piece started. The questions that give dad access to the visit. So, you know, if you're asking the mom the question, why can't you ask the dad the question and see how it goes? Even if it fails, the next time you have a better idea of what you might ask the dad instead. So be willing to try out new things and be creative. Prep for engagement. So this was the ask to join the meeting, ask to join the appointment, the visit. Ask them if they're there. If they're sitting in the corner, hey, do you want to come up to this table? I'm going to ask this screening questionnaire. Ask them to join. Invite them. So this is prepping in advance and having contact information for both parents. Even asking the dad to get, like gathering information from the dad, dads appreciate it. So you got my phone number, you got my email. I feel like I had some system that I could register for the delivery, and then I got all these emails from them too. And that was part of our follow-up, if I remember right. We got these follow-ups from this automated sort of system. Call and confirm, that's along the same thing. And then leave things. So this is why I started with talking about the materials and how those are focused. So if the dads couldn't come to a prenatal appointment, give them a copy of the materials if you have the ability to. Or maybe you have something focused on, here's some of the care that you should help, or for the other co-parent, this is what you could do to support the mom after she's delivered. Some thoughts to think about. And dads really appreciated that too. And then all things else were creative engagement strategies. We worked with a number of workers who had relationships were strained. Moms and dads didn't want to be in the room together. They didn't want to co-parent together. So they would either have texting. They would text in line with, you know, we just learned this. Here's some information about it. And she would get the mom's approval. And they would work together, and even sometimes if they couldn't stand to be together in the same room, they'd do a conference call, and they'd join in together and say, this is what we just talked about. And they were great with it, and they really appreciated it. And sometimes the moms would be like, he needs to know this. Get him on the phone right now. I told him to be available on the phone. And some of these strategies were really, really helpful. And then champion that creativity. So this is try to have a venue where you can talk about these strategies. So maybe, I don't know if you have meetings or monthly meetings or whatever, have a moment when you can talk about what worked creatively, or what driven strategies did we put into place that actually worked. But find a place where you can actually champion this and talk about it as a staff. Because you never know what works, and people jump off each other's success, and that can be really helpful. Okay, so what happened? So what did we find? So our pilot study, we had so many different success rates among all of our factors that we had to work with statisticians to make it look worse. Like we had to minimize our effect. Because we were seeing across the board, so this is like parenting alliance, like how people feel as a parent with the other parent. And we were, so in our field, effect sizes of bigger than 0.2 are seen as like, wow. And all of ours were huge. These originally were like over 1, and that was ridiculous. So we had to find ways to sort of reduce them and make them look more normal. But we found across parenting alliance, support, like relationship support, we found an increase. And abusive relationships we saw go down in terms of their reports, and other factors as well. We saw this with child neglect factors, improved parenting strategies, tons of positive impacts. And then we rolled it into our randomized trial, and we're seeing some of the same things. But of specific to note, excuse me, the services, we really wanted to make sure that we weren't harming the services, and that the mothers were not reporting that having more, having this time with fathers and the home visitor wasn't harming their relationship with the home visitor, because we think that's a really important relationship, or with the nurse. You want to form a really good relationship with this outside person as well. And so far we found that there's absolutely no variation. Moms find it of equal value, whether or not the father is there, which is a good sign. We didn't want to change that and alter that in any way. Fathers, we found that their perceptions of their contributions to their child life was expanding, so not just that economic role, but they saw that they could have an impact, or they felt that they could have an impact on their future child's development around education, health, well-being. So that positivity was there. They were feeling more confident in their parenting abilities also. All good things. So far, all good things, and we're really excited about that. Another thing that we found, this was in our pilot study, was that the children, the verbalizations, and this was our really cool measure, we found more interactions between dads and children too. And that was a huge effect size, actually, of more verbalization. So we'll see with a much, much bigger sample if that translates as well. Let me skip past that. Organization said, hey, it's totally doable. Just a few simple strategies got dads to more visits. And like I said, with the studies that we found, like we all went over budget, they were finding the same things. They found that they were filling their time very quickly because they now had 2 parents coming to these visits, and it was a really good thing. So with a very low impact, very few strategies, dads were very encouraged to come in. Other folks found that interventions could certainly increase that overall father involvement in the services and then translate it into the homes later. And then positively with services, father involvement in services or engagement in services, showed a higher retention, like around all these volunteer services in the next year to 2 years following like the initial intake. And then our current studies showed no change with that as well. Worker perceptions, when the fathers were present, workers were positive about their experience. And I did this in a larger study too across the country and found that across about 2,000 respondents that they were overwhelmingly positive in their experiences. And then they said that they were able to use very simple strategic strategies to engage dads, and that it was totally feasible. Totally, I've said that too many times now. But they also wanted to know what success looked like. And I said that example of the worker who said, I only engage half my dads, and the rest of the people were shocked by that high rate. But she felt that she was not succeeding. So having those conversations too about what that success would look like here. Let's see, I'm going to skip that one. Most fathers reported some sort of attendance at prenatal visits and some uptake in visits too, so that was a good sign. And then another study showed that early engagement, especially very early on in the child's life, translated to more feelings of attachment towards the child, not necessarily on like an attachment scale, but that they were noting that they felt more attached and a stronger parent because of that very early on attachment. Okay, I think I've talked about most of these. The biggest influence, I think, when I go in and I train people, is attitudes of staff and positive attitudes versus negative attitudes. And I was always battling at least one person in the room who really felt that shouldn't be done. But even that is a good discussion to have, and I think a challenging conversation to have. But I think you can illustrate like where some of the push and pull can be in an organization. So if you haven't had that discussion on, do you think that fathers should be more involved, and what does that look like, and what could that look like? It's an important discussion to have. Continue thinking about professional gatekeepers. I can't say enough how many times our studies were challenged by just random people who suddenly either put themselves in some sort of process that would limit the amount of fathers or people that are being approved for our study, or people that were coming into the program, but also, even at a higher up level, public policies that were being put in place to making it more difficult for fathers to get services, because they would change the requirements of these services that we had, that we were working with, to only work with the most high needs families, which always at the top of that list was the single parent mom. And then anything that had a dad involved too was lower in terms of need, identified need, even if it was high poverty, other issues. But that gatekeeping at another level up was another problem that we saw. And then continue to think about organizational culture. And this could be walking in off the street, to finding the champions who talk about that, to the gift shop. And that was where I hung my hat in my dissertation, to think about organizational culture, and all these little people like me who come in and do trainings, and what's the messaging from them on serving fathers too. So it might not just be people who work here, but other messaging that you get. And finally for us, this is just me. Next phase, we're launching this online. People can do these cool little simulations where you're sitting in a house with a dad. What do you say to him? It's a little funny. You have to get through this to get through a little maze. It's like a little video game. It's kind of fun. Okay. Hey, I ended right before time. Okay, so I flew through my findings. Do you have any questions? Otherwise, thank you for being here. Happy spring break, yes.
I have a question. When you mentioned that you changed your data to bring it down a little bit,
yeah.
What were your concerns that it was looking too good?
With a huge effect size and a small sample, there were certain dads that were really influential of the data. So you just have to be cautious with that when you have a small sample. So some of our dads were, almost outliers. They were reporting really low initially and then huge jumps. So we had to find some way to normalize that data, because they may have come in a little bit biased in terms of, I don't know, one scale or another, or maybe they misinterpreted that scale a little bit too. It's just something that you have to be cautious with when you have an uneven, and it got a little unbalanced because we had all the dads in the intervention side stay throughout all the interviews, and we had a bunch of dropout in the control group side. So the dads that were, and this was part of the trouble, was that when they were getting more engagement, they wanted to stay in our study longer, and other dads dropped out. So that became a little uneven. We kept the moms, lost the dads, so we had to find different strategies to account for that. And because of that, then it had big effects on how we calculate this effect size, because sample size really influences that. So we just had to find a new statistician to play around with the numbers. It makes you scared, right? But it's a more accurate view. It's a much more accurate view. Thanks. Good question. Yeah.
I'm just curious if all of everything you've done, if you've ever seen any pushback from moms about maybe not wanting the dads to be as involved as you're encouraging them to be and helping them to be, just with as many paternity issues as we've seen sometimes, and this whole power between who gets to be where and gets to do what between families. And did you ever see any moms push back?
Yes, and we certainly had cases where it was me on the phone with them, not the moms, but the home visitors, trying to educate moms about what the potential benefits of having the dad involved was. And so it was time again of like, I'm not, and we gave up on certain cases and some you pushed through, but yeah, absolutely, we certainly had that. And some who just never wanted the dad to be around. And so that's a little bias in the study too, because if we couldn't get both consented, then they weren't in the study. So there's a little bit of bias of more connected relationships in the randomized study. And that's one of our limitations. Yeah.
Sometimes because we see people for such a short amount of time, and the level of animosity and drama that comes about when the baby actually comes is unbelievable. And we just try to get through that to the basic cares of the mom and the baby and the dad are difficult.
Yeah.
So, and there is a lot of family drama that feeds into the mom and the dad's involvement in just learning the basics about what they need to know.
Yes.
So,
But I heard that a lot with young parents too. The grandparents are going to be there from the minute one too.
Yes, it's a lot.
Yeah. There's a lot of stress on new parents. Yeah. Thank you. Anything else? Thank you. You have 10 seconds on that clock. All right, thank you. Have a great day.